Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. Just a quick reminder, like us on Facebook, YouTube, follow us, tag your friends, click like. We'd like to have your views to follow us and kind of keep up with what we're doing here at Momentum Chiropractic. So a quick introduction, we have Tony here. So this is not Tony's first visit, this is his third visit now. He came in, he was telling me about some low back pain, just discomfort, had to move around, couldn't really lay still in one position. He works where he carries about 60 to 70 pounds of equipment, and so he's having that tight low back. One of the symptoms that was intriguing about his first visit is he's reporting like 8 out of 10 low back pain. So that's pretty high, right? Little bit of low back pain that kind of comes up the mid to low back. But one of the symptoms he's reporting is numbness and tingling in his arms. He feels like his arms are falling asleep. Now, when we're assessing this type of situation, when we're talking about arms falling asleep, the most common issues would be some sort of compression issue here in the shoulder, some sort of cervical involvement or neck involvement with some degeneration, some disc herniation, so on and so forth, or some positional, maybe sleeping like this with your arms up and feeling that numbness and tingling down your arms that falling asleep. But like I said, his symptom that he was saying is like, I have severe low back pain. He's not really complaining about neck pain, but then he's saying his arms are falling asleep. So, Tony, as we've seen you, this is your third visit. Today, all we've done is E-stem. We did the first 2 times we did electronic stimulation, adjustments, hot packs, a little bit of soft tissue stuff. What have you noticed improvement?
So, kind of after the first week, I kind of noticed probably my arms were kind of still tingling and numb. After that second visit, pretty much all this whole week that we've gone up to, my arms haven't fallen asleep once. I've been able to stay in my bed, stay in one position a lot longer without having to wake up, roll over, and then try to get back to sleep.
And what about the low back pain? I know initially you said it's like an 8 out of 10. Are you feeling it at any certain pain level now?
So now, I mean, it may be a little bit annoying when I'm doing back exercises.
Yep.
But as of now, it's not really there at all.
So interestingly, right, we're associating, like on your common textbook, it's like, oh, numbness and tingling down the arms, it's got to be a neck issue, right? This is a good lesson to show that not every patient is like, not every patient is textbook. We have that symptom that's going down low back, having this radiation down the arms. Now, could it be tied in? Of course, it could be compressing the upper, the cervical muscles. It could be compressing the thoracic muscles, just because of the fascia. They're all connected. Low back issue, tightness, we're having the symptom. So in him, low back pain just about gone, numbness and tingling in his hands about gone, and today we're just kind of addressing like tight muscles between the shoulder blades, upper back. So that's kind of the first thing he said, hey, low back's feeling much better. Can we move up and focus a little bit higher? And that's what we're doing today. So today we're just going to show you chiropractic adjustment. We'll start off with a little bit of a neck adjustment. We're going to use the little turbinator right here in the upper back, the vibro unit, and then we'll have him lay face down, just a general chiropractic adjustment like we have in the past with them, and go from there. All right, so we'll have you set up, Jason, right over here for adjustment. And then for you, Tony, if you can, just scoot just a tad forward like that on the chair, and then lean your upper back just right there for me. Good. Okay. And we're going to get in here and try to adjust here through the cervical region first here, okay? All right, relax right in here for me. Okay, good. All right. Scoot a tad forward for me. Right there's good. Relax right here for me. Very good. Okay, very good. Let me have you lay right there face down for me.
Sure.
Okay. We're going to use a little Makita drill, Makita vibro unit. So loosen up some of these muscles. So just so you guys know, I'm going to kind of keep the drill off a little bit. I'm going to address one of the comments we had on one of our previous videos. We use the Makita drill to try to loosen up some of these soft tissue. As a chiropractor, I do believe that addressing these segments with adjustments will eventually create some lax muscles, some relaxed muscles. The hypertonicity would go down. However, I do like to utilize the immediate soft tissue therapy so that we can relax some of these muscles right now and get in for the adjustment. In some cases, I mean, we're dealing with this much muscle here, so we want to get in. I'm going to bring the heat when we do adjust, if you guys have seen on video, but I also want to relax the muscle a little bit to get some nice movement in here. adjustment here. Okay, we're gonna adjust right through the thoracic region first here, okay? So I want you to take a deep breath for me. Completely exhale. Very good. Get some movement in there? It's a silly question, huh? Relax here. Very good. Relax here. Very good. Take a deep breath. Completely exhale. Very good. Lay on your side facing this way for me. Okay, top leg bent, bottom leg straight. So, yep, there you go. Put this foot behind the knee. Give me this arm right here. Position your head right there for me. Right here. Right there. Take a deep breath. Completely exhale. Very good. Lay facing the opposite way for me. Good move. And that would be what diminished your low back so quickly, is getting that movement in there. You know, that inability to stay still, to sleep in one position. When we get good movement in here, breathe in, all the way out. Very good. Lay face up for me. When we get good deep adjustments like that in the low back, we increase that mobility in the lumbar spine. Very good. And you know that lumbar spine is not super mobile. So when we do give it the mobility that it needs, we get some drastic improvement like you're showing. Relax here. All right, brother, we're done. Help you up here. Good. Excellent. Thanks, sir.